County Board meeting to order. Let's stand for the Pledge of Allegiance, a moment of silence.
Allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Hi. Supervisor Ewer, will you sign in, please? And Supervisor Thornton. All right, thank you. We have 4 absent tonight. I'd look for a motion to approve the agenda. Second. Motion by Supervisor Mickelson, second by Supervisor Gullickson. Any discussion? All those in favor signify by saying aye.
Aye.
Aye. Opposed? I would look for a motion, oh, sorry. Members of the public wishing to be heard, Henry Schockel.
Good evening. For those of you that don't know me, I'm Henry Schockel, former supervisor of District 5. The reason I'm here, I've got a few comments on Resolution 01-20 relative to highway funding money. How did we get here to where we are today? Well, some years ago, a local politician decided he had a good idea. Let's get rid of fuel tax indexing. Yeah, it was a good thing for getting votes. Didn't do much for the highways, but he pushed it through. So there was strike one against the highways. Then came Doyle. He decided that there wasn't going to be no tax increase. So he raised a bunch of fees, doubled the auto registration fee and a bunch of other fees. Then he robbed it all to balance the budget. Then he bonded to send out all the checks to the other government entities in the state for road use. Then it took 25 cents out of every dollar coming in from fuel tax, registrations, and everything else just to service the debt. So a few more strikes against us. So then came Walker. Be no fuel tax increase. So for 15 years, I attended meetings relative to road and bridge use. As a county official, as a town official, and as a private individual, my message was always the same: raise the fuel tax. The user then pays the bill. Anybody from the legislature, oh, the governor says he'll veto it. The governor will veto it. My response was, this is not partisan. Work together, override the veto, get the job done. Nope, wouldn't come to the table. So, then came Evers. First words out of his mouth before he even took office were, we have to raise the fuel tax. Well, guess what? The legislature won't even put it on the table. So, I guess I'm guilty too. I supported him. I campaigned for him. I voted for him. What happened? I guess we got just a bunch of invertebrate hypocrites in Madison, not only from Chippewa County in the area, but all across the state. Now, what are they trying to do? They're trying to pawn this off onto county boards. They don't want to take the responsibility for their job, is what it amounts to. So, Eau Claire County already fell for it. They put in a $30 wheel tax. So they keep pushing this. Oh, you have tools in your toolbox, I believe was what one said. Yes, so they don't have to do it. That's what it amounts to. Now, we got this resolution. It's fine to send a resolution down to the state, yes. Get off of your dead backside and get something done. But this tech and this ability to put a 0.5% sales tax on, I think that's wrong. I don't see where that's right. If it does go through, one of the first counties that'll put it on will be Eau Claire County. We'll put it on right away, and then they may be able to repeal their wheel tax, because if Eau Claire County puts it on, the following counties will pay for their roads: Chippewa, Rusk, Dunn, Clark, Taylor, and Jackson will pay for Eau Claire County's roads. They'll even be able to put a little shimmer of gold over the top, because if nobody did the research on this to see where dollars were spent and how they were spent. Now, there's millions of dollars spent every year all around the surrounding counties around us and in Chippewa County for home renovations, additions, outbuildings, and everything else. Well, guess what? None of these counties I listed have a Menards. Eau Claire County has 2 Menards. They come from miles and miles and miles around and load up with building materials. So all the people in the surrounding counties are going to pay for Eau Claire County. Now, I'm frankly surprised that this got out of committee even. When you look at it, Brian is from Rusk County, one of the poorest counties in the state. Maybe Menominee is poorer, I don't know. So, and, you know, our administrator comes from Lincoln County, and Lincoln County isn't exactly a spin-off of Fort Knox either. So, here we come with this. Is this going to be fair? No, this. My time up? Well, anyhow, I got to say much of what I wanted to say, and I thank you.
Motion to approve the consent agenda. Motion by Supervisor Thornton, second by Supervisor Gullickson. Any other discussion? All those in favor signify by saying aye. Aye. Opposed? All right, we have no reports, so we'll go right into business items. Resolution 01-20.
Who it is?
Did you shut that one off? Should I shut mine off? I can talk loud. But
Let's shut them all off.
highway operations. Now therefore be it resolved that the Chippewa County Board of Supervisors does hereby direct that the county administrator work with the state legislators that represent Chippewa County as well as other interested stakeholders to request that the state of Wisconsin create legislation that would allow all counties the option to implement an additional 0.5% sales tax to be used to maintain, repair, and construct streets, roads, highways, and bridges. And be it further resolved that the Chippewa County Clerk is directed to send a copy of this resolution to State Senator Kathleen Bernier, State Representative Rob Summerfield, State Representative Jesse James, Governor Tony Evers, and the Wisconsin Counties Association, forwarded to the County Board by the Highway Committee.
Motion to approve. So moved. Second?
Thank you. Happy New Year, everyone. As you know, we've been working through this as one of my goals for 2019. We gave a presentation at the county board, and essentially the next step was to go back to the highway committee, talk about options, talk about basically if there's anything off the table. We gave that presentation to the committee, and the committee really kind of landed on the possibility of working with legislatures to do this 0.5% sales tax. And that's why we brought it forward in a resolution form. What we would do is, if you approve this tonight, we'll try and work with the legislature. As I mentioned before, there was a bill that came out in, I believe, 2016 or 15 that dealt with this issue in trying to do this. Obviously, this is a long way away from getting done, even if, you know, we get permission to move forward. But what we would do is we'd work on other partners to try and get it through the legislature. And again, this would only be an option for the counties. It doesn't mean that the counties have to do it. That's how we envision the bill if it gets passed. But it would change. I put the presentation in the packet that was presented at the Highway Committee because it did have a timeline. And if we pass this, it would change that timeline because we'd need some time, obviously, to work that through. What that timeline looks like, I cannot give you an exact date on that. It really would depend on the legislature when they want to bring it forward. Would they want to try and put it in the biennium bill or budget or not, or have a standalone bill? So there's a lot of moving parts with something like this. So any questions? I know we talked quite a bit about it before.
I guess I didn't understand that our resolution was going to tie this just to roads and bridges.
Yeah.
I thought we were going to ask for support an additional 0.5% sales tax, period.
No, all the conversations we've ever had to do with highway. It had nothing to do with anything else. The current one is for that purpose. I mean, you can use it for different, depending on what counties decide to do with it, but yep.
The county had the option.
Yep.
Supervisor Gullickson.
The legislature is passing this ball off to the counties, which is, I think, a disgrace. I understand we're looking at trying to get some funding for highways, but the bottom line is, I don't believe a 0.5% sales tax is the answer. Again, today I saw another 100-ton crane. This time it was going up 53. These vehicles are doing more damage to the roads than all the cars in Chippewa County going over that road. And the legislature has got to take a look at this issue and get a fair and balanced funding mechanism in place. Sales tax, you know, when we take a look at it, what is it going to do with our economy? What could it do to the current 0.5% sales tax? Who's going to adopt it? Who's not going to adopt it? I think I've mentioned before, if we would adopt 0.5%, and Eau Claire went, what is it, 5 minutes longer to go to Eau Claire to purchase products? And then take a look at our existing 0.5% sales tax. Is that going to start crashing out too? There's so many working parts in this that have to be figured out. I think there's got to be, I agree with sending a resolution to the legislature, but I think we got to put a lot of options on the table, not just one. Thank you.
Six yes, 5 no. Resolution 02-20.
Resolution number 2-20, resolution to approve the 2020 annual work plan of the Forest and Trails Division of the Department of Land Conservation and Forest Management, and to authorize the LCFM Department Director to apply for a County Forest Administration grant from the State of Wisconsin Department of Natural Resources. Now therefore be it resolved that the Chippewa County Board of Supervisors hereby approves the attached 2020 annual work plan of the Forest and Trails Division of the Department of Land Conservation and Forest Management, and be it further resolved that pursuant to 28.11 Wisconsin statutes, the County Forest Administrator is hereby authorized and directed to complete and submit required application materials for the aforementioned County Forest Administration grant in the amount of approximately $46,313.49 to the Wisconsin Department of Natural Resources, forwarded to the County Board by the Land Conservation and Forest Management Committee.
Motion to approve? So moved.
Dan Masterful will go over the plan.
Good evening. I've got a 6-slide PowerPoint that kind of distills the operational plan priorities, and then I can entertain questions on the plan or the resolution. This is a map of the Chippewa County forest and the recreational trail systems in the forest. We have about 35,000 acres. It's a mixture of different types of timber, predominantly oak and aspen with mixed hardwoods, and then some lowland species. We also have an extensive trail network that's used for public recreation. The county forest is managed to balance forest production, environmental management, and recreation. This is our organizational chart for the Department of Land Conservation and Forest Management. And the green group here is the Forest and Trails Division. We have a county forest administrator position, an assistant forest administrator position, and 2 LTE seasonal techs. They're supported by our administrative framework, including our assistant or our accountant and our administrative assistants. The purpose of the work plan is it sets operational priorities, and it's used to augment our 15-year county forest plan. It's used to allocate our available resources, our staff hours, skill sets, and money. And it's a requirement of the Wisconsin Forest Law as a condition of receiving annual staffing grants from the Department of Natural Resources. With regard to operational priorities, I've broken this into 3 slides. We have county forest management. One of our main operational priorities next year will be to recruit, orient, and retain qualified staff. We now have a county forest administrator position and public liaison position open, and we're actively recruiting for that position now. We're also in the process of filling our 2 LTE slots. We had a retirement this year of our long-term forest maintenance tech. One of our main priorities this year will be to update our county forest plan for the next 15 years. This is a policy document, and the committee has appointed an ad hoc advisory committee of stakeholders that has begun to meet and step through the planning process. We'll be moving through that planning process commencing here shortly. We want to maintain our forest silvicultural treatments. This is the management of the forest and our current harvest schedule. We'd like to accelerate our invasive species monitoring and control. And something new this year, we're going to identify and plan sites for future tree planting. With regard to forest roads and flowage maintenance and management, we intend to manage and maintain our forest road system using our established maintenance schedule. The ungated forest roads, the primary roads, are maintained by the Highway Department. Our gated forest roads, those that are used intermittently to provide access for timber harvests, they're maintained by logging contractors as they open these sites up, and then by our forest and trail staff. We maintain flowages and dam infrastructures. We have 18 dams and flowages. We do engineering assessments and relicensing on those, routine and maintenance, and dam reconstruction slated for one of our flowages. Importantly, quite a bit of our routine maintenance and inspections are being done by citizen volunteers who are being trained as part of our volunteer program. Finally, with regard to recreational trails maintenance, we host and maintain an extensive recreational trail network of both motorized snowmobile and ATV trails and non-motorized trails. including ski, bike, ice age trail, and horse riders. We manage the state Old Abe Recreational Trail from Chippewa Falls to Cornell on behalf of the state. And we actively have designed and implemented a robust county volunteer program, which involves registration, training, and certification, and then recognition. We right now have 25 or so volunteers who we're systematically training and working with largely through the user groups. So with that, Mr. Chair, that's my PowerPoint, and the plan itself was attached to the agenda as with the resolution.
Any questions, comments? Supervisor Gullik?
Yeah, just one correction. The LCFM committee voted to suspend the committee, basically waiting for the new county forest administrator to be put in place and then to adopt the process that this person would be more familiar with. So just wanted to make a note that that committee that was appointed has been suspended by vote by the LCFM committee. Thank you.
Do we approve this plan every year?
Yes.
We do, okay. All right, thank you.
Yes, it's updated and customized. It includes, the important changes include a designation of which components of the county forests are going to be slated for timber sales. That's called out in this plan, and then any special focus areas.
It's required, right, Dan?
Yes, it's required by the county forest law.
Any other questions? Let's go. Release. 11 yes, 0 no. Resolution 3-20.
Resolution number 3-20, resolution to formally close the home health care program within the Department of Public Health. Now therefore be it resolved that the county board does hereby authorize the county administrator and the public health director to formally close the Chippewa County home health care program in the Chippewa County Department of Public Health. And be it further resolved that the county administrator and the public health director are authorized to take all steps necessary to close the program, including ensuring that all current clients' patients have been referred to and or enrolled with other area home health care services providers. And be it further resolved that the home health care services program shall be closed effective March 13th, 2020, unless all steps necessary to close the program, including ensuring that all current clients' patients in the program are referred to and or enrolled with other providers, occurs prior to that date. Forwarded to the county board by the Health and Human Services Board.
Motion to approve.
Motion to approve.
Second.
I'll say a few words before Angie, our Public Health Director, comes up and gives the presentation. But first of all, as I've been saying since this has come out, and it's in my letter, that our employees did everything possible to try and keep this program running, not just this year or the previous year, but for years. As Angie will talk about some of the things they've tried to do. They've done everything we've asked them to do. We had to, unfortunately, lay off some people about halfway through the year, which helped reduce our deficit, but it would still continue, and our employees have been working extremely hard. We've had a difficult time trying to recruit and retain employees for this for several reasons that Angie will bring up, but I think the reason, as you'll find out, all the other ones that have closed already, I think the reason ours was able to stay open as long as it could is because of our dedicated employees. So I just want to make that very clear before Angie comes up, and then we'll be available for any questions.
Good evening. I'm Angie White. I'm the Public Health Director. I also have Jody Mooney, the Home Care Manager, and Sarah McQuillan, the Fiscal Manager in Public Health, with me as well. As Randy said, this was a very difficult decision, and we really did look at as kind of a perfect storm right now, which we're having a hard time recruiting and retaining staff, and we also have a new payment model starting that makes it very tricky for small home health care programs to continue to stay afloat. Going to go over a PowerPoint that shows a little bit of the historical overview and some of the reasons behind this. Our home care program in Chippewa County started in 1966. So we've been here about 53 years, and in the last 20 years, home care programs around the state that are out of the county level have been closing. And I gave some data here just about the western region, and we're part of the western region. So in 2008, there were 11 counties of the 18 in the western region who still had home care programs. And then by 2010, Burnett, Eau Claire, Trempealeau counties closed their programs. By 2012, Monroe, Washburn, and La Crosse closed their programs. In 2015, Polk closed. And then since 2015, Dunn and Rusk have closed their programs. And then Pierce County was the most recent to close, December of this year. Pierce, Dunn, and Chippewa were the last ones in Chippewa County that were left open. Pierce and Dunn had smaller programs than Chippewa County did historically. Both of them closed even sooner than they anticipated they would close when they announced that they were going to close. So a lot of times things do roll faster than even than you expect when you do announce that you're going to close. I think that was the same slide. Sorry about that. Then just to give a little more history of some of the things that we've attempted, in June of 2015, we did a Whitfleet study where we paid and had consultants come in to talk about things that we could do to help either increase our revenues or decrease our expenses. And myself and the home care manager implemented those changes, and we did see a reduction. You know, we were at about negative $200,000, and we took it to negative 10 and negative 20. So we were able to make some impact through that Whitfleet study. Over the past several years, our department has had a really difficult time recruiting and retaining home care staff. And the main reason for that is people can make a lot more money in medical professions at hospital and healthcare systems. A lot of people, when they leave us, they go and they make $12, $13 more per hour than they do at the county level. And with all of the counties closing around us, obviously people don't feel like they're on sturdy ground. They're going into positions of home care agencies and other agencies that have large programs and that have programs that really aren't at risk of closing. Historically, too, we've had a large home care program. There's 2 other counties in the state that are still open, and they also do have large programs. Those are Calumet and Greene County, and Calumet and Greene both also have hospice, which there's a natural referral site if you have a home care program from home care to hospice. Nobody really makes money in home care, but you can make money in hospice. And so when you have both services together, the hospice kind of absorbs some of the loss that you're seeing at the home care level. And in 2017, I feel like these are on here twice, sorry. In 2017, myself and the home care manager met with our local hospital and health system partners to see if there was a need for further hospice programming. And if we were going to expand, we would have needed to hire a nurse practitioner, which is a master's degree trained nurse. And their wages quite hefty, and at that time the county wasn't wanting to put more money into home care, and we did not assess that the county had a need for more hospice services. So currently there are enough providers providing that hospice care. Then due to budget hardships, this past June we did do a layoff in home care where we laid off 5 staff. And then now we have to kind of come up to speed to today, there's a new patient-driven groupings model, which is a new Medicare payment model that's taken effect January 1, 2020. PDGM is diagnosis-based, and it requires more documentation and specification. And it is also suggested that programs have a reserve of money to support the reimbursement changes that will be taking effect with PDGM. It's also going to benefit larger home care programs, and it will be difficult for smaller programs to survive. Just today, Jody, the home care manager, brought me the home care magazine journal that is put out for home care professionals. And we just got this today, so we're about a month or 2 ahead of the experts apparently. State of the industry for 2020, home care leaders on PDGM and what's coming. And what it says in these articles is that they think 30% of home care agencies will close in the next year. And they are advising that large home care agencies buy small home care agencies right now. So unfortunately, we're Historically, before we were considered a large entity, and over the years, we've seen our numbers go down and down, and the Mayos and HHSs have seen their numbers go up. So we are not a large program, and it would be extremely difficult for us to continue to stay open with this new payment model. I did also just want to let people know that we currently are at 37 patients. Many of the patients that we have on our caseload right now are VA or veterans, which is actually a good thing because it's easier to find care for veterans. They actually do get paid through home care, and so it is much easier to refer a veteran than a non-veteran in home care. And a lot of these things obviously are based on the payment model and how you get paid to do these services. However, I would say that, we didn't strictly look at finances. We really did look at the ability to retain and recruit staff and to keep people still out there serving the citizens of Chippewa County. We also did pull some numbers together, and from the 2019 budget, before we did the layoff, we were projected to come in at negative $120,000. For 2019, with doing the layoff, it was negative $54,000, excuse me. Then the next graph shows kind of the trend line for expenses and revenues. You can see that our expenses continue to stay quite high and our revenues are decreasing. Then this shows us our 2020 projection, and it is hard to project because it's a new payment model, and they talk about with a single patient you might see a 30 to 50% reduction, but it really depends on that patient's diagnosis, so there's a lot of factors that play into that. But for 2020, our projection was around $71,000, and then we put together a grid because it is challenging to show exactly or to predict exactly what our loss would be. We put together, if we had a 5% loss, what would that look like for tax levy all the way up to 40%? We do suspect it would be, somewhere in the 20-30% reduction, but again, with the new model, it's really hard to tell exactly what that would look like because it is dependent on the patient's diagnosis. And then who will be impacted? Our current home care staff, there's 7 employees that have not put in resignation or retirement, a full-time home health manager, full-time RN, an LTE RN, a full-time home health aide, 2 part-time home health aides, and 1 account assistant. So we had 2 full-time RNs that already had given notice, 1 retiring and 1 that had found a new position, and we did have our full-time home health aide put notice in as well. And then here are the home healthcare agencies in the Chippewa Valley that we would be referring our patients to. We do feel like we would be able to secure care for all of the 37 patients that we have left on caseload. If by chance we were not able to secure care for an individual, we are obligated by state regulation to give a 10-day notice to individuals, letting them know that we are not able to provide care and that this is our notice that they need to find other care. And we are pretty hopeful that we would not need to do that, knowing that there are 2 more months left. And, we were at about 60 patients a month ago and we're at 37 today. So people do discharge off caseload and some patients would need a referral. And then lastly, I just wanted to say I completely agree with what Randy said, that our staff have done a tremendous job on a weekly basis. I do hear a lot of gratitude from board members, community partners, citizens of the county that say thank you for the great work that your staff have done with my parent, my grandparent, different people that they care about. So the team has definitely done a good job in really providing excellent care. It is just really hard to retain the staff, and the payment model changing has kind of put us in this position. Also wanted to just say a special thank you to Jody and Sarah for showing great leadership and staying extremely positive with their staff through this.
Questions?
First of all, I want to thank you guys. Any department here, I think your
Angie, you and your staff have been very frugal. Last year, budget time, you wanted another position. You went to Randy, and Randy said, no money, but you found the money somehow. A lot of times on the board, we're asked to do a lot of things, look over the budget, make policies, come up with mission and vision statements, which is all fine and well, but I'm thinking that one of our biggest jobs as a board is to take care of our elderly. So I got really mixed feelings about this. I know it comes down to money all the time. At $72,000 over a year, it sounds like a lot, and like I said, you guys being very frugal, and I understand the funding, and it's going nowhere. Well, on the other hand, last summer, we did one paving job of 1.3 miles. There was $264,000 appropriated for that, and actual cost was $439,751. That was an overrun of $175,751, which would run your department for another 2.5 years at $71,000 a year. So, but again, I understand the other financial aspect of this. I guess my only concern is what happens after March if you can't place all these people with other agencies.
Yeah, I mean, again, I think that we will be able to find care for the folks. If there are 1 or 2 people that we can't find care for, we would give them the 10-day notice per the state regulation. I know Jody and I have been looking over caseload, quite a bit over the last few months here, and the specifics of who's on caseload. And with the majority of them being VA, I do feel pretty certain we'll be able to find care for everybody.
What happens if you don't? I guess that's my question.
Yeah, then the individual and their family would have to find care from another agency, which we would provide them, obviously, with information, but, it is possible that they would run into the same avenue that we would run into and have a hard time. It is hard for some people to find care. I will definitely acknowledge that because, we get people that other people don't want because they're not going to make money on them.
I was just going to say, I've had agencies reach out to me already because, the word's out. So they're already calling to see what they can do to help. So I find that encouraging. And we're going to, do everything we can possibly do to try to find them placement.
Could you update us at next month's meeting?
Absolutely.
To see where we're at?
Certainly.
Okay, thank you.
Thank you. I know you'd mentioned you feel confident that we're going to be able to find placement for this population, and at the committee level, you said you felt that the level of care and service was going to be that which the county provided them. There wouldn't be a drop-off, so that's another plus there. But given the information that you brought tonight about the state of the general market of this healthcare, do you feel that the list we have here is a list that they're sustainable organizations? Change is hard, especially at that age, and for family members trying to organize all this. Do we feel confident that the ones we're referring to are stable programs, that they will be able to continue to get that quality service?
That's a great question, and thank you for asking that, because obviously we don't want people hopping from provider to provider to provider. I think especially the systems that are a part of hospital and health systems are more stable. And the reason for that is there's numerous services in hospitals and health systems, and some bring in money and some don't. So just for example, if you have a family member going in for mental health treatment or services or need a long-term stay, the hospital's going to lose a lot of money on that. They're going to make a lot of money on cancer care. They're going to make a lot of money on hospice. So hospitals can offer lots of different services because they have some that bring in a lot of revenue and they have some that bring in less revenue and they wash out. Hospitals still make a profit.
I want to say thank you for the work you have done and the staff. My wife was a home health care nurse. I know how attached you folks get to your patients, and I know this was a very difficult decision to make, and thank you.
Thank you for that. I appreciate that. We'll let our staff know that as well.
Yeah, I too want to say thank you to you and your staff. I know I can tell, you're emotional. I'm sure you guys, it's hard. It's really hard for you guys to come and give us a budget you're eliminating your jobs at the same time. But, I'm gonna contradict what Supervisor Hartman said, though, is, sometimes government doesn't belong competing in the private marketplace, and this program is absolutely set up for the government not to be part of. And I want to commend you guys for taking, taking the initiative and taking the hard stand and saying, hey, it's not working, and making a change. So thank you for that. I do have one tough question, though, and that is you're going to have a budget. You have about $130,000 of unused levy money. What is that levy money going to be used for?
So actually, home care pays for a lot of our administration costs because we do a system called AMSO where it's distributed based on FTEs, and home health care is our largest division. So actually, we would have been at a deficit. However, we did secure $64,000 worth of funding for NFP, Nurse Family Partnership, since we did our budget. And we brought in the Drug-Free Communities Grant, which is $125,000 per year. And $9,000 of that is towards administration costs. So we're within $2,000 of a wash. So thankfully, we secured other funds. Otherwise, we would be looking at needing money.
Thank you.
You're welcome.
Questions? Let's vote. Release? 10 yes, 1 no. Thank you.
Thank you.
Resolution 4-20.
Resolution 4-20, resolution to authorize compensation and mileage reimbursement for up to 100 days of committee meetings in 2020. Now therefore be it resolved that the Chippewa County Board of Supervisors does hereby authorize that the number of days that supervisors are entitled to compensation for attending committee meetings is increased to 100 days per year for 2020. And be it further resolved that the compensation for all days for services on committees over 30 days each year shall be compensated in the same manner as the first 30 days were compensated, including reimbursement for mileage pursuant to Section 2-71 of the Chippewa County Court of Ordinances, recommended for approval by the Executive Committee.
Statutorily required, we do it every year.
Any questions? Let's vote. Release? 11 yes, 0 no. Resolution 5-20.
Resolution number 5-20, resolution to approve revisions to the strategic plan and the vision and mission statements. Now therefore be it resolved that the attached strategic plan and vision and mission statements are hereby approved and made the official strategic plan and vision and mission statements for Chippewa County government, and be it further resolved that all future county boards should review and revise the strategic plan as deemed appropriate and as priorities change.
Motion approved. Second? Second. Okay.
Thank you. As you know, this is one of my goals, probably personal goal when I first started here. I wanted to do a strategic plan. The last one that was completed here was 2011. Just felt like it needed to be updated and have the input from the current board. We obviously went through a planning process. Joseph and I got to spend a lot of time together, which I enjoyed. He did a great job, especially out in the communities, bringing everybody together. And it was, if you sat through everything, including the department head meetings, they really were in line. What the county board felt were concerns, what the citizens felt were concerns, and what our department heads felt were concerns, and areas we wanted to address really flowed together at the end of the day. So this is what the final plan looks like. Obviously, if you want to make any changes, this is the time to do it. I do not plan to keep this on the shelf. Obviously, as we move forward, we'll be rolling this out to department heads and then future boards. I won't wait 8 years to do another one. So, but it is what we will tie everything to for the vision of the county moving forward. So any questions?
Do we, you want me to press my button? So you don't want to wait 8 years before the next one, so do you need to put a timeline on this?
I don't know, I mean, it's
You want to date it?
Do I want to date it? I'm sorry, do I want to date it, or do you want to put an end date on it? Is that what you're asking?
Yes.
I don't think so, because it's something, as long as I'm here, it's something I'm going to be pushing, unless the county board feels otherwise, but, I think, we just got finished with this one. The new election is in April. We'll probably wait till the next election and update it again. That would be my plan. So it's up to you guys if you want to, but personally, it's a very high priority for me. So I'm going to keep it on the front burner. That's right. That's how I feel. I don't think it needs to be, personally, but because I know how I feel about it and what a priority it is for me.
Thank you.
Any other questions? Let's vote. 11 yes, 0 no. Ordinance 13-19.
Ordinance number 13-19, ordinance to amend section 2-52 of the Chippewa County Code of Ordinances regarding attendance at meetings, second reading.
Motion approved. So moved. Second.
Second.
We went through this pretty much line by line last time, so I didn't have any questions between the meetings, but if there's any additional questions, we'll try and answer them.
Let's vote. Release. 10 yes, 1 no. Ordinance 01-20.
Ordinance number 1-20, ordinance to amend section 70-146 to 70-154 of the Chippewa County Code of Ordinances regarding signs, first reading.
I'll have Doug explain this one. Come on up, Doug.
Are you watching the live stream? I am. You guys all look cool online. Come this back. Yeah. So I, as the statement of explanation states, that we looked at the sign language within the zoning ordinance and kind of worked through it over about an 18-month period. It started out with putting some information into the ordinance to allow those electronic message centers, is what they're called. So basically the digital billboards or the digital LED signs that you see on the gas stations or some type of motel, hotel. Along with that, there was a federal court ruling that we tried to fold into this as well to try to make it a little bit more easier for individuals to get signs and not necessarily look at the language on the sign. I can tell you this, that the decision that was handed down is complex to read through, and it says, on one hand, this is how you have to look at the signs, and then on another hand, it says, you can do it this way. So it was really tough for us. So this is not it's a finished product for right now to get it in the ordinance, but I'm sure we'll have to make some tweaking over the next year as some court cases around the United States make their way through their court systems and through the Wisconsin court systems to make minor adjustments to this. But it's a step in the right direction for those digital billboards. Some individuals do not like them and other individuals do, and that's why we kind of brought this forward, or at least zoning brought it forward, is because we were having a lot of requests from business owners instead of looking at that static sign, being able to change the message on there, and this kind of accomplished that. So with that, I work through the zone towns. This is only applicable within the zone towns in Chippewa County. So if it's, as an example, town of Getz, town of Delmar, it's not applicable in those locations because they have not adopted the Chippewa County zoning ordinance.
So as I look through this, how do existing signs get grandfathered in? Do now they have to fall into this compliance, or how does that work?
No, if a sign is legally non-conforming, so legal meaning
Non-conforming as of today? I mean, is the existing signs going to be grandfathered?
well, it's a twofold question. If you came in and you got a permit and it was legally permitted, then yes, you would be grandfathered in if this ordinance were to affect your particular sign. If it's an illegal sign, which means that they didn't come in and get a sign, they're not protected underneath the grandfathering clause.
We've already caught them people and already told them to take their sign down, right?
Some of them, yes. Yeah.
Yeah.
Yeah. Some of them we don't have permits on because they were put in the 1970s. Some of them were put in the 80s, some were put in yesterday.
But my sign was put in 1970 and now it's not conforming, is this is gonna make me get rid of my sign?
No, it will not.
Okay.
It will not. No. So we take a look at it and try to figure out when we looked at this actually increases the size of signs that individuals are allowed. The increase that the signs that were installed in the 70s and 80s, the signage requirements at that point in time were actually increased in the 90s. So we've only gone up in the signage that we've allowed. We haven't really reduced it in any way, shape, or form. So if you have a sign and you do not have a permit for it, we will look back through the records and then we will make a determination as to whether it's conforming or non-conforming and whether it's legal or not legal. So.
Okay, I do have one more question for
Sure.
you. How are we, if I go to 3D, the owner of the sign must provide at least 5 hours per month for public messaging announcements at no cost to the town in which the sign is located. I struggle with that.
Yeah, and thank you for bringing that up because it was a question that we had at the public hearing too. Now, that is only for the off-premise advertising signs, so it's not specific to the business owner themselves. So your sign at your location, Steve, would be an on-premise sign. So it's on your location, you get the LED sign, you are not part of that requirement. But if you, as an example, if you drive up and down 53 and you see the digital billboards that are in the village of Lake Hallie, those are off-premise advertising signs, and those are the signs that get the 5.
Pay thousands of dollars a month to put their advertising on there. I still struggle with me taking 5 hours of their time.
They are the ones that recommended it.
Okay.
So when we originally worked through all this, they were the ones that wanted the digital billboard signs, and they're the ones that said, this is what we've done in other local municipalities.
The advertisers, or they meaning the sign owners?
The sign owners. So, yeah, so it's not your sign that we're looking at. So if someone wanted to come onto your property and put an off-premise advertising sign on, then they would fall underneath this. That is their off-premise advertising sign, and they pay you rent or lease or whatever it is on that site.
Yep.
So it doesn't affect you in any shape or form.
Yep.
It's,
I wasn't worried about me. I just don't think the government should get something for nothing because
Yep.
we can't get anything for nothing. That's all.
well, yeah, the sign companies at the time, this is what they propose it, so we're like, we'll take it, you know?
Thank you.
Yep. Okay, you're welcome.
Is this the first reading?
Yep.
Motion to go into closed session.
Make a motion that county board convene into closed session pursuant to Wisconsin State Statute, Section 19.85, Parent 1, Parent G, for purposes of conferring with legal counsel for the governmental body who is rendering oral or written advice concerning strategies to be adopted by the body with respect to litigation in which it is or is likely to become involved, specifically litigation involving Emerge Energy Systems LP, United States Bankruptcy Court for the District of Delaware. The county board will convene in an open session after.
We got to vote on this. Hang on. Okay, vote. Release. Any communication? Items for future agenda? Motion to adjourn.
So moved.